Dr. Petersen joining us from the Holtorf Medical Group and talking about something that I've had questions about before today.
Really?
What is integrative medicine? Have you heard that term? And if your doctor throws it out there, what does it mean?
Well, there's a lot of terms like that. Alternative medicine, integrative, complementary. Alternative medicine are the things that they do in Eastern medicine that we in Western medicine say, well, where's the evidence? The reality is that in Eastern medicine, or in the Eastern countries like China, Japan, India, they've been doing these things for hundreds, if not thousands of years, and now they have been teaching for the past 100 years integrative medicine along with Western medicine. Now, it's become, patients here are becoming more receptive to it, and so there are Western medical schools that are starting to include that, whether it's acupuncture or massage or those sorts of things. UCLA has an acupuncture course specifically for MDs.
Does that mean it's effective? Does that mean those procedures work?
Great question. Yes, and what matters is let's do the research and show that they work. And it's hard to do because the standard that we have on evaluating, for instance, a drug is a double-blinded placebo-controlled trial. That's a big bunch of words, but it's hard to do a double-blinded trial on something where the practitioner is doing it, whether it's acupuncture or massage or manipulation, those sorts of things.
You know, should we be concerned about what doctors have learnt 20 years ago but haven't updated their knowledge? How do we find out if they are updated with these sorts of things? Seriously.
That's critically important. I actually brought an article this time from the New England Journal of Medicine. This article states that it takes on average over 17 years to go from research to clinical practice in the United States of America. That's abysmal. Now, ironically, the article is from 2003, so next month it will have been 10 years that we discovered that it takes us 17 years. So in 7 years, we'll read the article.
Why do things move that slowly? Why can't we speed up that process?
Well, it's multifactorial. Part of it is the way we're educated. We receive our education in a medical school, but we receive our training from physicians that are practicing. And I've been practicing for 12 years, and if I start training someone, well, I'm giving them knowledge from 12 years ago, presumably, unless I have stayed at the point of the spear and I am cutting edge. And there's a lot of things that discourage us from doing that.
Should the average patient come in and say, what is, to their doctor, what is complementary, what is it integrative, and do I need it?
Well, I guess I would say that integrative is when you have alternative medicine and Western medicine, and you're doing them both, because it's sort of the best of both worlds.
I love that. I love it.
So should you ask about it, though? I mean, have you asked your doctor about that before?
I'm a firm believer in those types of medicines. I think once you put them together, it's even better.
Absolutely.
Modern science as opposed to traditional Asian or Indian, I think I'm a firm believer. Everything can work.
My clinical experience is that they both work at times.
I
but
agree.
Together, they work so much better.
It's opening your mind up as well, doctor, and making sure that your doctor also has that open mind. Where do people find out if their doctor doesn't have that open mind?
Well, I think you ask them questions and you say, hey, I read this. What do you feel about that? A lot of doctors, because of our insecurity, if someone comes in and says, I read this on the internet, there's two reactions. There's the, well, I'm smarter than you, so that's irrelevant. Or there's, I've never heard about that, but let me find out. And if your doctor says, wow, I've never heard about that, let me find out, then I think you can probably trust that he really wants to learn.
And health funds, they're becoming more and more liberal with paying for these things.
Insurance companies?
They are becoming more liberal, but that's a problem because, and that's one of the discouragements for staying at the cutting edge, because insurance companies, it's hard to insure a moving target. So if there's a new therapy, well, now they have to pay for something they weren't factoring into their cost before, right? So there's a great example. There's a brand new weight loss drug approved in January. Well, only about half of the insurance companies are covering it. It's FDA approved, it's a regular drug, it's not like this is something we're getting from the Orient, but they don't want to pay for it because that's just one more thing to pay for.
Oh God,
that's
hard to do.
So
angry.
So don't learn about the drug, because as soon as you learn about it, you write the prescription, and then the patient comes back and says, I couldn't get it filled, doc.
Yeah, but guess what? You take the weight loss drug, you have the health insurance to cover it, you lose the weight, your blood pressure goes down, your cholesterol goes down, you become a healthier person.
Well, or you say to yourself as a patient, my insurance is not covering this. I'll just pay for it myself. It's my health and it matters to me. And until the insurance companies catch up and start paying for a new test or a new medication or an alternative medication, I think we have the responsibility to our own bodies to say, I guess I'll do that myself.
If not, you'll be waiting 17 years.
I know.
It's just a number we keep throwing out today. Or you can go to Holtorf Medical Group, because that is a place they are practicing. And you can actually ask them about this too, which I love. You can say, what do you think? And is this the right treatment for me? All of their information is going to be on our website. Go to abc4.com/dailydish, and we'll put it right there along with Dr. Petersen's contact info.
As always, great information.
Thanks so much.
Doctor.
Coming up next, we are in the kitchen, and it can get crazy when there's a lion in there and a Caesar salad. You get this recipe next.